my name is Janakkumar and my master topic is about diabetes. First, we need to talk about what is diabetes. Diabetes mellitus is defined as a metabolic disorder of multiple etiology characterized by chronic hyperglycemia with disturbances of carbohydrate, fat, and protein metabolism resulting from defects in insulin secretion, insulin action, or even both. For the people that didn't understand that, diabetes is a condition where the body does not produce enough insulin. Insulin is a hormone produced by the pancreas that helps glucose, which is the main source of fuel for our body, move from the blood into the cells. In diabetics, the cells cannot use the glucose, and this causes the blood glucose level to rise. There are 3 types of diabetes we should understand: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes is predominantly a childhood disease and is more common in developed countries. It is more known as juvenile onset diabetes. Type 2, on the other hand, is late onset diabetes and develops more commonly in people over the age of 40 years. Gestational diabetes is less common in the other 2 forms. It is first diagnosed during pregnancy and is primarily a temporary intolerance to carbohydrate, which returns to normal after birth. More than 40% of women with gestational diabetes develop type 1 or type 2 diabetes in the following 10 years. It also increases the risk for birth defects. Babies of women are more likely to develop obesity and impaired glucose intolerance as well as diabetes in later life. Why is this a cause for concern? Everyone's at risk. In family history, your risk increases if a parent or sibling has had diabetes. In environmental factors, circumstances such as exposure to a viral illnesses likely play some role in type 1 diabetes. In the presence of damaging immune system cells, sometimes family members of people with type 1 diabetes are tested for the presence of diabetes autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes. In dietary factors, this includes low vitamin D consumption, early exposure to cow's milk or even cow's milk formula can also cause diabetes. Where you live also matters. Certain countries such as Finland and Sweden have a higher rate of type 1 diabetes. Now for something that you can probably control, your weight. The more fatty tissue you have, the more resistant your cells become to your insulin. Your inactivity. The less active you are, the greater you're at risk. Physically, activity helps you control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. Now, race also is a clear factor as well. Although it's unclear why, but people such as blacks, Hispanics, American Indian, and Asian Americans are at a higher risk of developing type 1 and 2 diabetes. Your age also matters. Your risk increases as you get older. This may be because you tend to exercise less, you lose more muscle mass, you gain weight as you age. But type 2 diabetes is also increasing dramatically among young children, adolescents, and younger adults as well. Women that have been diagnosed with gestational diabetes are at risk of developing prediabetes and later even type 2 diabetes. If you gave birth to even a baby weighing more than 9 pounds, which is equivalent to 4 kilograms, you're also at risk of type 2 diabetes. And polycystic ovary syndrome, women that have this syndrome are more common condition characterized by irregular menstrual periods, excess hair growth, or obesity, can also increase the risk of diabetes. Having high blood pressure, which is over 140 over 90 millimeters of mercury, can also be linked to increased risk of type 2 diabetes. Abnormal cholesterol and triglycerides level can also increase diabetes. This is more commonly known as lipoprotein or good cholesterol, and you're just risking the chances of obtaining type 2 diabetes. Triglycerides is also another level that we can gain diabetes from, and it's pretty much another type of fat that's carried in our body. And the more higher our triglyceride level are, the more increased risk that we get of type 2 diabetes. For the people that are pretty much want to control this factor, you just need to get a blood test by your doctor to determine if you have high or less triglyceride or abnormal cholesterol, and this will help pretty much determine your risk. Complications that may occur. Cardiovascular disease. Diabetes dramatically increases the risk of various cardiovascular problems, including coronary artery disease with chest pain, heart attack, stroke, and narrowing of the arteries. If you have diabetes, you're more likely to have heart disease or stroke. Nerve damage, neuropathy. Excess sugar can injure the walls of our tiny blood vessels that nourishes our nerves, especially in our legs. These can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upwards. If this is left untreated, you can lose all sense of feeling in the affected limbs. Some after effect damages that can occur also relate to our digestive system, which can cause problems to nausea, vomiting, diarrhea, and constipation. For men, it can also cause erectile dysfunction. Kidney damage, neuropathy. The kidney contains many tiny blood vessels, glomerulia, that filter waste from your blood. Diabetes can damage this delicate filtering system. Severe damage can lead to kidney failure or irreversible end-stage kidney disease, which may require dialysis or even kidney transplant. Eye damage or retinopathia. Diabetes can damage the blood vessels of the retina, potentially leading to blindness. Diabetes also increases the risk of other serious vision conditions such as cataracts and glaucoma. Foot damage can also occur. Nerve damage in the foot or poor blood flow can also increases the risk of various foot complications. If this is pretty much left untreated, cuts and blisters may occur, and serious infections will happen, and pretty much it will never get healed properly if this happens. And in the end, infections may ultimately require toe, foot, or even leg amputations. Skin conditions can occur. Pretty much people with diabetes are more susceptible to skin problems, including bacterial and even fungal infections. Hearing impairment. Hearing problems are more common in people with diabetes, so something you should know. Now, here's the shocker. Alzheimer's disease. Alzheimer's disease is more in type 2 diabetes, and it pretty much increases as your blood sugar, poor your blood sugar is. And it's pretty much your greater risk of getting Alzheimer's disease, and it's pretty much uncalled for, but scientists are trying to recall why is this a good complication for diabetes. What are some treatment options for diabetes? Insulin is one. People with type 1 diabetes need insulin therapy to survive. Many people with type 2 diabetes or gestational diabetes also need insulin therapy. Many types of insulin are available, including rapid-acting insulin, long-acting insulin, and intermediate options. Depending on your needs, your doctor may prescribe a mixture of insulin types to use throughout the day and night. Insulin cannot be taken orally to lower blood sugar because stomach enzymes interfere with the insulin's actions. Often, insulin is injected using a fine needle in a syringe or insulin pen, seen as in the picture below. A device also that looks like a large ink pen can also be used as well. Another form of treatment option is a transplant surgery. In some people who have type 1 diabetes, a pancreas transplant may be an option. Islet transplants are being studied as well, but with a successful pancreas transplant, you would no longer need insulin therapy. But transplants aren't always successful when you're conducting these procedures, and they pose more of a serious risk. Bariatric surgery. Although it's not specifically considered a treatment for type 2 diabetes, people with type 2 diabetes who have a body mass index higher than 35 may benefit from this type of surgery. People who have undergone gastric bypass have seen significant improvements in their blood sugar levels. However, this procedure, long-term risk and benefits for type 2 diabetes are not yet known, so there's more studies being conducted into this surgery. Oral or other medications. Sometimes other oral or injected medications are prescribed as well. Some diabetes medications stimulate your pancreas to produce and release more insulin at certain times. alternative treatment options we should consider is just eating healthy. Less sugary items in our diet, more fruits and vegetables in our diet, less animal products in our diet. Should be good to go in there. Getting more physical activity, more regular aerobic activities. Make sure, you ask your doctor if you're able to do this. A lot of times when you're old age, you can't do this stuff. Yoga. Practicing yoga, very good for your body. Can also lower down your blood sugar, which is really the primary goal of your situation. Meditating. In Native American studies, meditation has shown that it can lower blood sugar, relax your body, and remove the potential stress that diabetes may put you through. Here are some information and facts that you may have not known of. Does herbal treatment help as an alternative cure? Scientists don't recommend it as of now. Maybe down the line they might, but they don't find it as a viable option. Protein diet can help lower blood sugar, so make sure you have a protein diet so it can help lower your blood sugar. As of yet, there's no diabetes cure yet, but maybe in the next 50 to 100 years we might be able to find something. Trust what the doctor says. He or she is trying to help you, so make sure you trust what they say, you do what they say, because they're looking out for you. And diabetes is in your hands. You can control if you want it to die or if you want to live long. Here are some organizations that are pretty much currently researching diabetes: the American Diabetes Association, Canadian Diabetes Association, JDRF, Juvenile Diabetes Research Foundation, and the many others listed below. They're constantly researching and providing day and night research of how we can find a cure for diabetes. I would like to thank you guys for watching this presentation, and I hope you guys learned something today.